did pick up more hours because there was a more need,
Okay.
But at the beginning, it was like that. Now, you were dealing with a lot of nurses kind of burnout, tired of taking care of the COVID patients, kind of like we see no end in sight kind of thing. We've been dealing with it since, May, April, whatever it was. So, it's, personally, I think I've been pretty resilient, but since October, nurses are starting to be more like, I'm tired of taking care of these patients. They're getting kind of burnt out.
Oh, wow. So, I mean, I could see that. I feel like everyone's getting burnt out of COVID right now, and then and especially yesterday with DeWine hitting a reset button.
Yeah, I know. That's not good.
Yeah, a lot of people are upset about that, especially college kids about the bars.
Mm-hmm.
But I could see that. But let's see, how has COVID affected you mentally and physically as a nurse?
Mentally, I think, like I said before, I think I'm pretty resilient.
Yeah.
And just, having grown up and having responsibility on the farm and, at a young age. But at the beginning, it was really, really strange in the fact that because these patients are in a closed room, they're in a negative airflow room.
Yeah.
So the doors to the patient's rooms are closed at all times. And you put on your PPE and all that stuff before you go into the room.
Right.
And when this first hit the hospitals, we were instructed as nurses that once you go in that room, you get everything done that you can, and you're the only person, and, they wanted to limit anybody that went into the room.
Right.
So they said, as a nurse, you will be doing all cares. That means everything that needs to be done to the patient, we can, we've turned them ourselves. If the patient was on a ventilator, we were instructed to make vent changes per the respiratory therapist that was standing on the other side of the door.
Okay.
Which, we're not, as nurses, we do our nursing stuff, and then the respiratory therapist, they take care of the ventilator and all changes, and that's typically how it works. But we were like, we're not touching this ventilator because I'm not, I'm risking my nursing license to do that.
Right.
So that didn't last very long. So, the therapist would come in and make changes or whatever. But to get back to the psychological part of it, at the beginning, it was really weird in the fact that I felt like I was totally alone. Even though I was in the hospital working, once I went into that room, I felt like, holy crap, it's just me.
Yeah.
And I have so much responsibility for this patient, and nobody